introduce her just before she presents. And the third speaker is Kayla Forbes or Murphy, but maybe some of you know her by her maiden name, who has a biokinetics practice, where she is engaging with women during pregnancy and postpartum, prescribing exercise. So each of us will do a short presentation to give you some of the background, and at the end there will be an open discussion. So please stay with us. The presentation is being recorded and it will be placed on the NEPI project website. You will receive a link later on, and feel free to ask any questions. This is not only an academic presentation, it is for everybody interested in pregnancy. So even if you're planning to fall pregnant and you have some questions, please feel free. So I will start by introducing the background and setting the South African context. As most of you know, South Africans love their sport. We like to perform, we like to support our sports participants when they perform. But a lot of South Africans are also avid recreational athletes. As we look at the numbers of the Comrades Marathon forever increasing, a few weeks back we had the Cape Town August, or Cycle Challenge, where several thousands of people entered, whether they completed or not. At the coastal areas, surfing and paddleboarding is quite very often part of a family excursion. And then the latest craze is, of course, paddle. Will paddle stay? Will paddle continue? And these are the settings in South Africa. But just as we have such good weather, and a variety of aspects, we also are a country with rich cultural contrasts. We have our big divide between the rich and the poor, where some are living in very good affluent environments, while others have to make shift with the shacks that they live in. And these environments bring their challenges. In the rural areas, we still have few places where walking to fetch water, walking to find active transport is very often part of daily activity. And with this, we also have our security issues. Apparently, I was told today that we are also the most dangerous country for driving in, my children told me. And then part of our culture is also where we have mothers that are pregnant, often collectively engaging in discussions, having their children carried on their backs. And this is the South Africa where we live in, where we have affluent, but we also have some poverty. Apart from these contrasts, we are also a country where 47% of women are insufficiently active. And these are not pregnant women. This is the general population. 30% of our deaths in South Africa are also related to lifestyle diseases, of which physical inactivity is one of the risk factors. And as with our differences in languages, in cultures, in income, we also have differences in our disease. We also have the double burden of HIV and TB collectively with our lifestyle diseases. If we look at our physical activity levels and we compare it with the global percentages as well as the African region, we can see globally it's about 32% of women that are physically inactive, while in the African region, the average is about 15%. But South African women are 46% of them physically inactive. So we are talking about physical activity in pregnancy. If these are the percentage of women not pregnant being physically inactive, you can imagine what we will see in our pregnant populations. Unfortunately, our statistics on teenage pregnancy has also hit very high percentages. The government reported that 30% of teenage girls fall pregnant, and more of 65% of these are unplanned pregnancy. If you look at these statistics, this is before the age of 18. If we look at physical activity statistics of girls at this age group, 85% of them are physically inactive. So you can see the context where we want women to be active during pregnancy and postpartum. We can see that we generally have low physical activity levels, and yet at an age where girls reduce their physical activity is also where pregnancy now is starting to increase. So we're expecting even lower levels of physical inactivity in the future. Let's look at the healthcare in South Africa, and I'm not going to belabor this, but just part of the context to show you that against all these odds, we have the correct procedures in place. Our healthcare system is implementing the WHO criteria. With our public health and our private health care, women generally have access to good health care. The women are expected to visit clinics 8 times during their pregnancy. Most females, when they visit a healthcare clinic, they are screened for pregnancy. And during these visits, they are seen by a nurse. And at 24 weeks, they receive an ultrasound. Yet the majority of our unexplained stillbirth are in the final 4 weeks. Please, Mike, mute the mic. Are in the final 4 weeks. So now we say we need these people with these challenges to be physically active during their pregnancy. But what are the expectations of physical activity during pregnancy? The most recent guidelines state that 150 minutes throughout the week in a minimum of 3 days should be accumulated. And this should be people that are already active should keep being active. If you are not active, you should start gradually becoming active around your house, out and about, and do some leisure activity. As you can see in that photo, you are welcome to do yoga, climb the stairs, do your shopping, cycling, walking, dancing, swimming. And every day's activities count, so it does not have to be to go to the gym. It's important that you also incorporate at least 2 days of strength training in a week to strengthen your muscles and prepare you for labor and also for breastfeeding. There's no evidence that exercise will harm you if you engage in moderate intensity activity. Several studies are underway currently, and some might have been completed, so we'll see the publications shortly on the effects of high intensity interval training and resistance training. It is important to be careful not to do any activities that you can harm your fetus by falling or hitting anything against it. And that is something that's been in the guidelines for a very long time. You will notice there are several guidelines, and a lot of guidelines has been updated recently because most of the guidelines have been on the cautious end, rather warning women to be careful instead of promoting them to be engaged in physical activity. In this slide, you can also see the benefits of regular physical activity, such as weight gain, improves your fitness, reduces blood pressure, improves sleep, and prevents diabetes. It also improves your mood. I want to also refer you to a publication that came out, I think, 6 days ago on separate guidelines for the postpartum period as well, and they are by Davenport. So if we promote or want to promote physical activity, and we know the context in what we are having to get women to be physically active, we need to know, do we actually know how active South African women are? And doing a search of the literature, there are very few studies that have been done in South Africa. As far back as in 2012, Brunet did one in Gauteng, and this was across different trimesters in the Pretoria or the Tshwane area. And you could see that the percentage of women that were relatively inactive in the second trimester and in the third trimester on your left hand of the slide, then relatively active and active. And those percentages were 16% were active in the third trimester and 17% in the second trimester. So showing us that at some stages the physical activity decreased. This study looked across all trimesters, or specifically second and third trimester, and questionnaires were used. In another study by Watson et al., where she was looking at moderate to vigorous physical activity and the met minutes per week that the women were engaging in, she also found the changes in physical activity from the second to the third trimester in women from the Soweto area. She was using the GPAC questionnaire. And those that spent 300 and more minutes sitting time was actually 43% were watching television. So you can see that television forms a big part of the sedentary time. And if we look at some of the moderate to vigorous, specifically in the transport section, it was 52 to 43% was doing active transport. These are two studies. A more recent one was in the Eastern Cape, where the physical activity questionnaire, pregnancy physical activity questionnaire was used. And you could see this was also a cross-sectional study. And the majority of the participants were spending the activity in the light mode of at least 100 a minute. So there was no adherence to the 150 minutes guidelines in this specific group. So if we look at the data that we have, mostly are cross-sectional designs. A lot of these studies are also using subjective measurements, and we all know that if you have to report via questionnaire what you are engaging in your physical activity, in some contexts, that people forget that cleaning the house or walking or doing gardening or doing washing also contributes to their physical activity, which is of course picked up when we do objective measurements. We find that sedentary time is mostly for watching TV, and the physical activity is mostly through active transport. As linked to our high teenage pregnancy, we can also see that the level of education is very low. So we know that these girls that fall pregnant also drop out of school, and therefore we find that the majority of participants in this pregnancy studies were or only had secondary school qualifications, and 65% were inactive before they even felt pregnancy, and obesity was very prevalent. When asked about the information they received during their pregnancy, most of them received information via the television. In a study that we did, longitudinal data analysis with objective measurements, you can see that the energy expenditure dropped significantly between pre-pregnancy and to the third trimester. And at 3 months postpartum, these women were still physically inactive. We also looked at the weight gain during this in this study, and we found that the women gained weight, but the important part is that they only lost or retained about 5 kilograms of their weight after the 3 months post-pregnancy, and 75% of these births were cesarean section. So we need to understand that South African women are really in need of becoming more physically active, because there are so many benefits. My colleagues will speak to that a little bit later. But here are just two statistics from a study by Davenport, where they've indicated that 10 minutes of walking a day will already decrease your odds of developing hypertension or preeclampsia during pregnancy by 25%. If you walk for 15 minutes a day, it will decrease the odds of developing hypertension and gestational diabetes by 25%. And in a country where hypertension and diabetes, together with obesity, are the most prevalent risk factors, together with the physical inactivity, I think we are sitting on a time bomb for women that are not engaging in sufficient physical activity during their pregnancy. So the question now is why aren't South African women being physically active? What are the barriers? Way back in, I think this Time magazine was in 2010 or 2009, where they already said the first 9 months reshape the rest of your life. And one of my colleagues will also speak to that later on. So let's look at the literature that is available. So one of the studies looked at the perceptions of the mothers on physical activity during pregnancy, and the mothers believed it to be beneficial. But the messages they receive from family, from the elders, and sometimes from medical practitioners are that they should take it easy. Um, and other times they are called lazy. So it's this balance between being lazy or being too busy, but you have to take it easy. They often get the message that they need to rest and they need to relax. They shouldn't have stress. And that also often relates to having to relax so that you don't experience any stress. Other studies also reported barriers like morning sickness. Some women really experience it very badly, interrupted sleep, and specifically if there's also other children already in the house, then lack of time and money. I think this is a perception that we saw in other studies where some women perceive it to be physically active. You have to go to a gym, and that is not always necessary. Some reported that there's a lack of knowledge or information, and others reported their cultural beliefs are to take it easy. Some have to stay inside. Some are not allowed to do anything while or specifically after the baby is born. So these are cultural differences that are also embedded in the pregnancy phase of the woman's life. If we look at the research that was done by Watson, questioning the medical practitioners, there was a small portion of them that was aware of the American College of Obstetrics and Gynecology's guidelines for exercise at that stage. They did not know that strength training is also allowed, and 24% of them said that they did not refer their pregnant women to exercise professionals. While 39% said they will refer them, but then there's also the question of, even though they refer them, do they actually go? And they believe that exercise is good for pregnant women, but they do not have the knowledge to prescribe the exercise. So in some cases, the message is there, but the percentages is very low. So, what should we do to change the situation? From what we see in the literature, knowledge is a big gap, that we should target information, educational activities, and to get the message through that exercise. What type of exercise? Anything is better than nothing within safe margins. So if you're a medical practitioner or you're a to-be mother here, just start walking. If that's the message that you get tonight, then that's the good thing. But have medical clearance if you feel unsure. It's also important for these women that are pregnant that they want to engage in group activities. It's important for the people that engage and conveys the message on physical activity to understand the culture of the person that they are trying to motivate to be physically active. And of course, there should be sufficient dietary intake. A malnourished woman will find it difficult to sustain physical activity together with a pregnancy. So the implications of these interventions is that we should educate, we should demonstrate, we should activate and maintain. So it should be sustainable interventions. This will hopefully also help address the obesity during pregnancy, which can later develop into preeclampsia or gestational diabetes risk. I thank you for your attention. We will take questions at the end of my presentation. I notice I am a little bit over time. I apologize for that. I think we will go straight over to our next presenter, who is Professor Velma Libbe. Professor Libbe is a nurse from the University of the Free State whereafter she obtained her honours in midwifery and neonatal nursing science in 2000, and also her nursing education diploma from the University of Stellenbosch. She also holds a MTech in nursing from Tshwane University of Technology. And in 2010, she obtained a PhD in nursing from the Northwest University. She's currently the director of the research entity for quality nursing in midwifery. And she is focusing her research on neonatal care. Professor Libbe, we are looking forward to your presentation. You may start. Thank you very much.
Thank you so much, Hanli. And thank you, colleagues, for the invitation to speak here tonight. I hope I can contribute something new. Exercise is so important, and like Hanli just alluded, it's important for the mum, but it's also important for the baby. So I thought to focus my presentation on the effects of exercise, exercise that you do during pregnancy, and that effect that it has on birth as well as the postnatal outcomes. So let us have a look. Okay. So first of all, for me, it's very important that we embrace the physiology of pregnancy. It is important that we know that there's a cascade of events that can happen when we are pregnant, when we are birthing, and even in the postnatal period. And it's important that women understand their bodies, they understand physiology, and that helps them to make decisions that prevent a cascade of negative events. And pregnancy is one of those events that we can really implement, one of those interventions that make life so much easier. So let us just have a look. Then Hanli alluded on this, so I'm not going to go into too much detail, but exercise is important because there's physiological changes in pregnancy and we need to understand that. And exercise just helps to work through these changes. It helps to manage these changes and improve both the maternal and the fetal health. Of course, it helps for sleep, moods, energy levels, reduce bloating, and it also helps to prevent gestational diabetes, which is something we see quite often. And then it relieves stress. It helps you to enjoy nature, especially if you can go for your exercise in a nature environment. It lowers your blood pressure and cholesterol, and overall, it just enhances your self-confidence. But we have a very sedentary lifestyle these days. So like we said, light to moderate exercise up to 3 times a week. So there's a lot of birth outcomes which this thing involves. It helps us to reduce complications. So it helps with weight gain in a normal range, lower incidence of diabetes mellitus, like I've mentioned, which is blood sugar levels for the non-academics on the meeting. It helps to reduce the risk of macrosomia, so extra big babies that struggle to get out of the birth canal. It lowers the risk for high blood pressure in pregnancy and also the risk for prematurity. And our prematurity risk is quite high in South Africa, up to 10% of all births. It also helps with a physiological delivery, so a normal delivery with using the physiology of the body, and therefore then reduces the risk of cesarean section and instrumental deliveries, which is vacuum deliveries or forceps deliveries, especially in healthy singleton pregnancies. And the type of delivery don't seem to be affected by light resistance or toning exercises in pregnancy, so there's still some work to be done in that area. In the birth process itself, it helps to shorten the labor process. Regular exercise then also reduces the need for cesarean sections because the baby don't get stuck. Mum moves and the baby can move as well. And it helps with the easier pregnancy. And then also, if there's complications during labor, they're much fewer. And then, of course, baby outcomes are quite significant. It improves the placental function, so your baby's getting more nutrition and more oxygen, and therefore the baby grows better while in utero. But also then in the birth process, things will go smoother. On postnatal, after the baby has been born, mom will recover much easier because there's some muscle memory, and the muscles are healthy, so we can work with that and help with postpartum weight gain. Of course, this is together with things like breastfeeding. It also reduces the risk for postpartum depression because exercise and depression, or low risk for depression, is clearly linked. And then for the baby, it improves metabolic health. So the babies grow better, they absorb their food better, and they have a lower potential for obesity rates. And then my personal favorite, exercise, and then everything that goes together with movement, that closeness between mum and baby, that have a huge effect on bonding between mum and baby, but also between dad and baby, if dad is very involved in the pregnancy and in the labor and postpartum period. So there's lots of different guidelines, and I think with the discussion, maybe we can elaborate a little bit on why all these different guidelines and which is actually the correct one. But like Anli said, walking is excellent, and that should be nice, fast walking. So not strolling down the road. It should really be increasing your heart rate a little bit. Swimming is excellent. It protects the joints, especially because when you are pregnant, there's a hormone relaxin that's being released so that the pelvis open up a little bit and there's space for the baby to move. So swimming is very protective in that way, but it also gives you that cardiac input, but also give you that resistance exercise. Prenatal yoga, strength training, your intensity, like we said, 150 minutes per week. And then we don't want to do exercises that will cause a lot of overheating, lying flat on the back after the third trimester, because then the baby pushes on the mum's aorta, and then there's not enough oxygen going to the baby. So we'll just modify that a little bit, turn a bit to the side, and the problem is solved. And then we need to know that most exercise is safe for pregnant women. A mum who cannot really exercise would probably be a mum that is on bed rest. And that doesn't mean she can't do any movement. There's then adapted movement that mum should do so that she don't get blood clots, and complications such as that. Now, in the midwifery environment, the focus on health, or on exercise and pregnancy, is mostly on health education. However, there is a lot of midwives that's very interested in this area and do extra courses to help their pregnant mums to actually do exercise and do the right kind of exercise. So look for a midwife or a clinic where there's good trained people that can provide you with exercise and exercise guidelines during your pregnancy. So the question is why? We know it's healthy, we know you're going to feel better, and all those kind of things. But especially in our modern environment, it's important to know that we sit a lot. Now you can look at the pictures here and see if we stand, then you can see the angle there of the pelvis. This is what you see at the bottom, in the sketch number A. And you can see how the pelvis is more nice and upright. And then you can see when the mum is sitting, how that is being tilted. And then if you are slumping, then you can see that pelvis is totally in the incorrect position, that slope that we have. And this is our problem in birth. This is why it so often happens that you go into labor and then the doctor says, oh, the baby is stuck. We can't get the baby out. Now it's time for a C-section. Also because we have a very much medicalized way of looking at birth. So I hope these two pictures will explain that. So your picture on your left, you can see that angle of the arrow. So this baby is not in a nice, soft, curved environment. There's a lot of angles the baby need to move through in order to move through the birth canal. The one on your right-hand side, you can see the baby is much better tucked in and the baby can much more easily move through the birth canal. Now, what's important here, if we talk about strengthening and toning, is we're going to look at the abdominal muscles specifically. These muscles tend to move open if you want to when you are pregnant, because remember, there's now a baby of up to 3.5 kilograms that need to have space somewhere in your abdomen. So your muscles need to make space for it. And if those muscles are not nice and strong, then you find that the baby is not lying in the right position. So the muscles aren't contracting the uterus, actually. It's not contracting well enough to bring the baby into the right position. So in the first 2 trimesters, so for the first 6 months, 7 months or so, the baby will not be in this position. The feet will be at the bottom and the head will be at the top. And then mom starts to get Braxton Hicks contractions. That's those practice exercises or practice contractions. And part of the function of that is to help the baby to turn around so that the head is at the bottom and that the best part that can open the vagina is then in the position where the baby can be born. So it's important that mum move enough so that this positioning can happen. And if you sit the whole day, then this is not happening. So here you can see a nice example of how the curvature of the back will change, whether you're sitting upright or slumping a bit. So doing something easy, like if you are watching a lot of television, then tonight use a Pilates ball to sit on, because that will automatically bring you in a more upright position and help the baby to be in a better position. So again, don't overdo it. It would be good to do that with a biokineticist that have skills in this environment. But the important thing is we want to move the baby. The baby need to move. The baby is part of the birth process. So this video is just to give you a quick idea of how does it look when a baby moves through the birth canal. And sorry, I
Stronger with
couldn't
you
get
than you buffer and pour your money.
the
Tumelo got
ads
naked at the office party.
deleted.
You can get naked anyway.
So here we go.
During a vaginal childbirth, the first stage of labor lasts about 12 to 19 hours and starts when your baby settles lower into your pelvis. In response, your cervix begins to efface or become thinner and dilate or widen. During this time, you may feel strong, regular contractions occurring every 5 to 20 minutes, and lower back pain and cramping that doesn't go away. You may see a brownish or reddish mucus discharge, which could be the mucus plug at the opening of your cervix falling out. Your water may break, which can either be a large gush of fluid or a continuous trickle. If you experience any of these symptoms, contact your doctor or midwife to see if you should go to the hospital. At the beginning of stage 2 of labor, which can last from a few minutes to 3 hours, your cervix is fully dilated to 10 centimeters. And your baby's head has moved beyond the cervical opening into your birth canal. During this stage, you will begin to push your baby out. You may instinctively push when you feel the urge, or you may need coaching from your doctor, midwife, or labor nurse as to when to push and when to rest. In a normal delivery, your baby's head will rotate to face your back. During active labor, your uterus is divided into an active segment that contracts, pushing the baby downward, and a flexible passive segment that remains relaxed, stretching to provide more room for the baby to pass through. In some cases, when the top of your baby's head appears or crowns, your doctor may make a small cut called an episiotomy to enlarge the vaginal opening. Then you will continue pushing your baby out. As your baby's head passes through the birth canal, it molds into an elongated shape. An elongated head shape will resolve itself within a few days as the skull bones shift back into place. After your baby's head exits the birth canal, his or her head and shoulders will rotate to help the shoulders pass through the birth canal. Your baby's shoulders are delivered one after the other in order to fit through your pelvis. Once the shoulders emerge, the rest of your baby slides out easily. After your baby is born, his or her umbilical cord will be cut. In stage...
Okay, I'm just going to show that part. And the reason why I showed it is just to give you an idea of there's different places where the baby can get stuck. and especially if the baby is not actively participating. This is a dance between mum and baby. So either in the inlet, so this is the red line you see on the screen. So these are the mums that are in go into labor or have their first pregnancy, and the baby doesn't move into the birth canal. And it often happens just because those muscles aren't exercised, they're not practiced, they contract as they should. Then you can be in the birth process, and then there in the middle stage, the baby can get stuck. So there's two spinas, that's little areas that stand out, areas of bone. And if the baby is not moving inside and mum is lying on her back, then the baby can get stuck at that point. But if we just get mum moved in the right way, then we can solve that problem. And then at the outlet part, that part the baby can then also get stuck. And if they get stuck there, then we know we have a cephalic pelvic disproportion. Big words to just say the baby is too big for the birth canal, but we can move in order to open that birth canal. Now, the reason why we have these problems is because we medicalize birth. So this is just a picture to show that there may be no engagement. So you can see the very right picture is where the baby moved into the birth canal. On the left is before the baby moved in. But if those muscles didn't lift the baby up a little bit, then the head didn't tilt well and the baby would not move into the birth canal. So here I would like to give credit to the Birth Ready method. It's a program that you can take which goes through all of this information in much detail. It's a great course to take. Then you become a birth detective as well, and you can see maybe the baby is stuck in the midline like I've showed. The baby is not moving down. This can be because of mobilization, incorrect position in the pelvis not opening. So there's some ideas of exercises one can do then to help the baby move. Then we can have cephalopelvic disproportion, which is usually when the doctor will tell you the baby's head is too big for the pelvis. It's usually rather the mum that is not moving enough. So the maneuver that we use traditionally is to bring the mum's legs up quite a bit, almost to the mum's shoulders, to open that pelvis so that the baby can be born. But there's other exercises and movements that we can do to help the mom to open that area, like the hands and knees and the side lying. And now it's important to know if the baby is stuck at the beginning or at the end of the pelvis, at the inlet or the outlet, because that will tell you whether mum must open her legs or close her legs, because that will rotate the hips in different ways. And I'm not going to go into too much detail. Just know there are different ways to do it. Then postpartum, one of our big challenges with positioning is bad feeding positions. And that's something that you can easily fix beforehand. And then, of course, if we start carrying along those little ones, because you just throw them on your hip and off you go. So those are also things that you need to have evaluated and be very aware of so that your posture is correct. Otherwise, you're going to have a lot of painful muscles when you have this little one. So the important thing is that we should understand why we do exercises in pregnancy, how it influenced the birth process, and then what the effect will be for healthy mothers then after the birth. So I'm just finishing off with a short video. It's important to move even in birth. So my challenge to all of the clinicians on the call tonight is maybe it's time for you to work out an exercise program or a dance program for pregnancy and birth. Thank you, Hanli. Over to you.
Thank you, Velma, for your presentation. That was very interesting. Colleagues, thank you for staying with us. I'd like to introduce you to our last presenter. I'm just also admitting people. Kayla Murphy, or Kayla Forbes now, she did the BCom Sports Management degree at the University of Johannesburg. After that, she completed a biokinetics qualification at WITS. She's always been an athlete, participating and interested in helping people. After her studies, she was fortunate to have an international experience at the Health and Wellness Center in Dallas, in Texas. And after she returned, she opened her practice in 2014, Fit for Two. So, Kayla, thank you very much for presenting here tonight. We are looking forward to what you're going to share with us.
Thank you so much, and thank you for the opportunity to speak tonight. It's a great privilege to be here. And I'm just going to share my screen. Can you see my screen?
We see your, yep, we have your presentation. All good.
Perfect, thank you. So implementing and sustaining exercise during pregnancy and postpartum. So movement is medicine even during pregnancy and postpartum. And I think sometimes ladies forget this, but with research over the years and with perceptions that have changed, doctors are now prescribing exercise more and more to pregnant patients. And we're seeing the benefits of it. And yeah, we'll go into a little bit more detail as we go into the presentation. So there are many changes that occur during pregnancy, and some of these changes can be very overwhelming, especially in a first-time pregnancy. So it's really important to know and understand what changes your patient is going through, both physically and emotionally. And it helps us provide a better treatment plan for our patient, as well as to be able to sympathize with them. And they'll also appreciate your knowledge and your understanding of their situation. So I'm talking to the clinicians here. So these are just a few of the changes that occur in baby and changes in mom by trimester. So our first trimester, which is the first 12 weeks, we have ovulation and conception. And this is normally when we have a confirmation of a pregnancy via the home pregnancy test, which will be followed by a blood test. So I'm not going to go over everything, but arm and legs are forming. Baby is known as a fetus by 8 weeks. The liver begins to produce red blood cells to carry oxygen, and the heart has 4 functioning chambers. And then we have some important changes in the mom. So she might have nausea or morning sickness, mood swings due to hormonal changes. She might have some breast tenderness, which can make lying on her tummy be quite uncomfortable, especially for exercise. Crazy cravings, food repulsion, headaches or migraines. She might have fatigue, constipation, diarrhea, or frequent urination. In our second trimester, which is 13 to 26 weeks, this is our golden trimester. There are tiny bones in baby's ears that are in place, and they can hear sounds in the womb. There's a thin layer of hair that starts to form on baby. The myelin starts to form on the nerves, and they have a distinct sleep and wake cycle. Changes in the mom, so we call it the golden trimester because normally the nausea and morning sickness often reduces or disappears during this trimester. She might experience some lower back pain. She might experience weight gain. We hope that she has a little bit of weight gain. Crazy cravings, headaches, and migraines can occur still. And then we have our third trimester, which is 27 to 40 weeks, where baby's eyes are starting to open, their brain is growing more, their immune system is in place, and the baby is clinically mature at 37 weeks. So changes in the mom, they might have some fatigue, discomfort, weight gain, back pain, and Braxton Hicks, which are false contractions during pregnancy. So the frequency, we want to be exercising 3 to 5 times a week, and we said at least 150 minutes. So moderate to high intensity exercise with an RPE rating of 11 to 14, and we can also use the talk test as an intensity measure. And the type of exercise we like to do is aerobic, functional strength, proprioception, posture, core stability, flexibility, relaxation, and breathing exercises. So a time for each session, we say, is about 45-minute sessions. Obviously, this depends on the individual. So back in the day, like we said, doctors would recommend bed rest to pregnant women. However, research has changed over time, and it's shown that there are many benefits to exercising during pregnancy. And a lot of the doctors are now prescribing exercise during pregnancy, which we are seeing a lot in our classes that we run. So we have maternal benefits of prenatal exercise. So we have cardiorespiratory fitness benefits. So we have increased aerobic fitness levels. Exercise increases ATP levels and energy to participate in activities of daily living. It leads to increased release of endorphins and increased endurance levels and an increased ability to endure the stress of labor. We then have musculoskeletal health benefits. So it leads to increased muscular strength and endurance, an increased ability to adapt to those postural changes that occur with pregnancy, an increased strength to support the extra weight of the baby that the mother's carrying, and decreased lower back pain, pelvic girdle pain, muscle aches and pains. We then have psychological health benefits. So it leads to increased self-esteem, increased mood. So the release of those endorphins can really help to prevent depression, which we all know is quite prevalent these days. Increased endorphins, which help to communicate with receptors in the brain and can help to reduce the perception of pain, especially during labor. Psychological health also leads to some other benefits, is it leads to decreased stress and anxiety. Body composition benefits, so it leads to decreased body weight gain, a decreased total body fat percentage. So it really helps to maintain a healthy body weight, which in turn can lead to a healthy birth weight in the baby. And then lastly, we have incontinence. So exercise can help to strengthen the pelvic floor muscles to help reduce or prevent incontinence. We then have fetal benefits of prenatal exercise. So we've mentioned that it's a healthy birth weight. So exercise leads to improved health and wellness in the mother. And a mother who practices healthy habits while they're pregnant can influence her baby's health. And this puts her baby at a higher chance of having a healthier birth weight. So we have reduced preterm weight and intrauterine growth restriction, shows that it's proven that consistent mild to moderate exercise can help to reduce the risk of premature birth, as well as that intrauterine growth restriction. It helps with cardiovascular fitness for the baby. So cardiovascular fitness in the mother can have a really positive impact on the cardiovascular fitness of the baby. And we always say a healthy and happy mom is a healthy and happy baby. And then we have a reduced risk of chronic disease. So if a mother maintains a healthy pregnancy, this can positively impact on the baby's health and reduce their risk of getting chronic diseases or conditions at a later stage. Early postpartum recovery is the first 6 weeks, and our goals during this phase are to prioritize rest, tissue healing, and gentle movements to support recovery. So key considerations here are whether the mom has had a vaginal or a C-section delivery, the body needs time to heal from birth. So hormonal shifts and sleep deprivation can impact energy levels and recovery. And you want to avoid strenuous exercise and instead focus on breath work, pelvic floor activation, and gentle mobility work. So recommended activities, we recommend diaphragmatic breathing, pelvic floor exercises such as gentle Kegels, gentle stretches and mobility work, and walking. So if the mom is comfortable, really to support that circulation and recovery. And avoid high impact movements, core heavy exercises, and heavy lifting until cleared by a healthcare provider. And then we have our 3 months onwards postpartum. And our goals here are to really gradually increase intensity based on the individual's recovery, energy levels, and fitness goals. So our key considerations are some women may still experience pelvic floor core instability, and modifications may still be needed. Sleep and hormonal fluctuations can influence energy and recovery, so it's good to have a more flexible approach at first. And recommended activities are strength training with resistance, high intensity workouts, functional movements to support those daily activities, so like carrying, lifting, and bending, and yoga or Pilates to enhance flexibility, stability, and that mind-body connection. So it's important to watch for signs of pelvic floor dysfunction, such as leaking, heaviness, and pain, and excessive fatigue or lingering abdominal weakness. And these can indicate a need for more rehabilitation and a referral to a specific healthcare practitioner before progressing. So we have benefits of postnatal exercise for mom. It improves mood, it increases cardiorespiratory fitness, it improves energy levels and ability to perform those activities of daily living. It helps to reduce or maintain weight. It reduces stress and anxiety and postpartum depression. It improves core strength, enhances sleep quality. It boosts self-confidence and mood, helps to reduce lower back pain, improves posture. It has many social benefits as well. It encourages that social interaction and support. It promotes hormonal balance, and it reduces the risk of diabetes, hypertension, and other chronic diseases. Benefits of postnatal exercise for baby: it improves bonding with mom. So activities like baby and mom workouts enhance that emotional connection. Skin-to-skin contact during gentle movement can help to release the oxytocin, which is really that bonding hormone. So exercise also promotes better sleep for baby. So exercise reduces mom's stress, and it really improves her sleep quality, which helps regulate the baby's sleep patterns. It also encourages baby's development. So tummy time and mom and baby exercises help with that motor skill development. It supports breastfeeding and nutrition. So regular postnatal exercise can help maintain milk supply as long as the mom stays hydrated and she eats well. It also improves blood circulation, so ensures better nutrition transfer through that breast milk. Helps regulate baby's mood. So it's a calm and happy mom lead to a calm and happy baby. It really leads to exercise. Exercise really leads to reduce stress in moms, and that reduces that stress hormone, which is cortisol, which can positively impact on the baby's mood. And it creates a healthy lifestyle foundation. So seeing moms stay active helps to instill healthy habits early on. And it encourages an active routine that can continue as baby grows into toddlerhood. We then move on to managing common postpartum challenges, which we have touched on previously, but we have time constraints, and often new moms struggle to find time for structured workouts, and this is due to feeding schedules, naps, and their daily responsibilities. So we say it's really good to incorporate baby-friendly workouts, incorporating those movements that allow mom to hold, wear, or interact with their baby, and doing squats and lunges and gentle yoga with their baby. And we also encourage short, more effective workouts. So your 10 to 15-minute workouts, doing body weight or resistance training, and really just incorporating your movements into your daily tasks. So doing calf raises while mom is brushing her teeth, or squats while holding baby. So there really isn't, there shouldn't be any excuses to not doing exercise during the postpartum period. Fatigue is also a big constraint, and we want to prioritize rest-based training. So listen to your body's energy levels and focus on gentle movements rather than pushing through that fatigue. Workouts should leave moms feeling refreshed and not depleted. So even just gentle movements can really boost those energy levels. And then thirdly, we have pelvic floor and core dysfunction. And issues like diastasis recti, like incontinence or prolapse, can affect postpartum movement and a woman's confidence to go back to exercise. So we say seek a professional assessment from a qualified women's health physio for any prolapse or incontinence or any pelvic floor issues that you might be battling with. And then we do gradual core rebuilding. So we want to start with deep core activation exercises, integrate the breath connection with the movements, and then we want to move to functional core exercises. So we really also want to avoid any high impact activities like jumping and running until you're cleared by a professional. And then we have sustaining exercise long term. So make it a routine. With unpredictable baby schedules, exercise often takes a back seat. So, schedule movement like a doctor's appointment, plan workouts in advance, and treat them as non negotiable self care. Find a consistent time that works. So, whether it's in the early morning, during nap time for Baba, or after bedtime, and a set routine makes it easier to stick with. And then find community support. So, motivation can drop without any accountability or encouragement. So join a mom-focused fitness group, such as either a virtual class or in-person postpartum fitness classes, and they can really provide motivation and connection with other moms. And then adapt to your energy levels. So sleep deprivation, hormonal shifts, and mom duties can really make exercise feel quite overwhelming and almost not we just really think that we can't do it. So we want to adapt to your energy level. So some movement is better than none. Adjust your workouts based on how you feel rather than skipping them entirely. And listen to your body. So on those low energy days, do more stretching or walking, breath work instead of that high intensity exercise. And lastly, set realistic goals. So many moms feel a lot of pressure to bounce back quickly, and this can lead to frustration and discouragement. So focus on progress and not perfection. Focus on the small wins, increased strength, less pain, better mobility, rather than the aesthetics and not perfecting the exercise. And thank you. That is my presentation.
Thank you, Kyla, for your presentation. Colleagues, thank you for staying with us. We're running a little bit late, but we really want to give you the opportunity to ask any questions. And I want to share with you before you start asking questions. Let me just share here on the share this window. On the 11th of May, can you see the screen? It will be active, Global Active Mother's Day. Is my screen available? Look, can you see the slide?
Yes, we can.
Thank you very much. There's a QR code. So if any of you are in an environment where you would like to organize an event, you can scan this QR code. And you can upload your activities for that day. I can share, there's another slide, how you can join. You register your event through this QR code that will take you to a Google form. If you're an instructor, trainer, physiotherapist, medical doctor, or a midwife or a specialist, you can organize something and your event will be on the NEPE website. The following information will be needed when you plan such a thing, event, sorry. Or you can send me an email. I will put my email in the chat box and I can share this information with you so that if it was too quick, you will see there are several events that will be taking place also, organized through the various special interest groups. So I will stop sharing now and I will put my email address. So please raise your hand if you have any questions. And to any of the presenters, what are your thoughts of running during pregnancy? Patient was a runner before falling pregnant.
Sure. So during pregnancy, if she was running before, then we would say continue running throughout her pregnancy. But obviously pregnancy isn't a time to run a marathon. So we would say she really needs to focus on modifying her running program, maybe taking it a bit easier making sure that she's hydrated, making sure that she is well, she's had a lot, her nutrition is good, her calorie intake is good. And yeah, as long as she's not feeling any pain or discomfort, or she doesn't have any high risks during her pregnancy, then I would say she can continue running.
Thank you. Okay, thank you. At least we were able to take your question, even though your microphone's not working. Any other questions from anybody on the line? Some of the questions that often come to me is there hazards. Many women have spontaneous abortions, and they want to connect it to some event. Do you consider exercise or being more physically active than before can contribute to this? Velma?
Hanley, it's quite a loaded question. It really depends on what the risk, what is causing the risk. So often moms with infertility treatment, even if it's a singleton baby, they are at a higher risk for miscarriage or for prematurity. So I would agree with the guidelines that we had. What you've done before pregnancy, one can usually continue with. But if there's any risk factors such as a sharp pain, any bleeding, things like that, or sudden high blood pressure or so, then it's best to consult your healthcare provider and that your exercises then change. So then we will move from high impact exercise rather to something like resistance kind of exercise, just to keep moving if you want to, but not have that extra strain on the uterus to keep the baby inside.
Thank you. I see there's a next question. When can mom return to training post-birth? Kayla, do you want to address that one?
Sure. Sorry, I was meant to mention it in my presentation, and I think I missed that. But basically, so when we say an uncomplicated vaginal birth, mom can return to exercise 4 to 6 weeks postpartum. And then with the C-section, we say 6 weeks once you've been to your 6-week checkup with your gynae and you've got clearance to exercise. And the reason that we say 4 to 6 weeks for even a vaginal birth that's uncomplicated is that there's some necessary tissue healing that needs to take place. And we've spoken to quite a few gynaes about it over the years, and they really agree with this. So it's really important to let that necessary tissue healing take place. But obviously, if a mom is feeling like she can do a little bit of walking and very gentle movement work, she can start just, before the 4 weeks. But when it comes to moderate and to high intensity exercise, we say a bit later on.
Thank you. I just want to add the guidelines that came out for postpartum 6 days ago. Also recommend that you start building up to 120 minutes a week. So you will notice it's not the 150 in that first period. There's another question. Nompumelelo, you had your hand up. You can ask your question.
Good evening. Thank you so much for the webinar. I think Ms. Kayla already answered about the 4 to 6 weeks, but I wanted to add on specifically with being realistic to women, because when they start to exercise postpartum, they think about the aesthetic side of it, not really the health aspect. So how do we actually become realistic with them gently before I just wanted to ask in that aspect, the counseling part of that, so they don't think about the aesthetic, but think about the health side of things.
Or did I hear you correctly, thinking about the aesthetic instead of the health aspects? Is that what you said?
Yes.
Okay, so they're more focused on losing weight than staying healthy. I think if they want to lose weight, they will most probably neglect their nutritional intake, and then they will suffer not have enough breast milk or nutritious breast milk to feed the baby. So I think they will very quickly realize that, and it can be detrimental to the rest of their health. Velma, you want to add something there?
I think what's important is that we give the right message. To look good is equal to be healthy, and to have a healthy baby that you can feed well. So I think the antenatal education part is extremely important. We need to give the right information, and we need to give the same information, irrespective of which healthcare worker you are with. So yes, I hear you, but I think it's important that we bring the message across. Looking good, aesthetics is equal to being healthy.
Thank you. And then there's another question from Voyeswa. Are there no risk of membrane rupture or cord prolapse during the last trimester? Which one of the two of you would want to go for that one?
I can answer. I don't think your risk is higher than it would have been if you were an active person in any way. If you are struggling with a cervix that's opening prematurely, then you would have in any way be a high risk mum already, and there would have been treatment, and your exercise plan would have been adapted already. But not all of a sudden. The body is wonderfully made. Those muscles are nice and strong to keep everything inside that need to be inside. So it doesn't increase the rupture risk. But you will not start, if you haven't done any exercise, don't start with horse riding, because then your risk would definitely be much higher. But continue what you've done and increase it slowly under guidance, then everything should be okay. But once again, if there are any danger signs like bleeding or cramping, or mum feel concerned that baby is not moving or not moving enough, then it warrants a visit to your healthcare provider.
Thank you very much. Any more questions? Seems like we've answered all the questions. And since we are running over time, I think I am going to wrap up our session here for the evening. Thank you very much, Velma, for presenting. Kayla, thank you very much for your presentation. And I thank the colleagues that joined us online. The recording will be on the NEPE website. You can go and listen to it again. And if you speak any other languages, there will be a Portuguese webinar coming up. There will be a Spanish one, Lithuanian and Polish one, together with our South African one in English. The others will all be in the native tongue. And please contact me if you're interested in registering an event. I'm happy to share those QR codes with you so that you can organize some physical activity on the 11th of May as part of Active Mother's Day. Thank you very much, and I wish you all a very good evening.